Environ Life Science Limited, partnering for life.
Hi, I'm Dr. K C Dharam Kumar, consultant dermatologist and hair transplant surgeon, Epiderma Skin and Hair Clinic, Jayanagar, Bangalore. So today I'll be discussing more in detail about the hair loss, or what we call as androgenetic alopecia, or the common terminology which is called as male pattern baldness. So what is androgenetic alopecia? It is nothing but the hair loss which we see in common individual, mainly in the frontal aspect. So you must have seen, even after they reach 70 years or 80 years, males or females, they lose hair only in the frontal aspect, not behind or sides. Why? Because the frontal aspect is more sensitive for androgens, what we call it as. So the hormone goes and binds in the frontal aspect and decreases the blood supply. So once the blood supply is on a decrease, whatever the hair, the nutrition it has to get, that is also compromised. So there will be series of thinning of hair. So this male pattern hair loss is not because of the increase in hair fall, it is because of the thinning of hair. If this is a thickness of hair, it keeps on thinning out and that will be eventually lost. Okay, so let us discuss more in detail about the treatment options. So coming to the first option, which is the medications, we usually give multivitamins because our diet, what we have in India, is mainly the carbohydrate rich diet, where we consume more of rice, chapati, which contains more of carbohydrates, and these days nobody eats more of fruits, vegetables and all. So some sort of multivitamin deficiency will be there. So we need to consume more of fruits, vegetables, so that the multivitamin deficiency will come down. And that's why we start on the multivitamins also, mainly the biotin, what we call it as. So along with that, few hair regrowth serums will be added, which you have to use it along with the main medication, which comes like a spray, which you have to spray mainly in the frontal aspect. So along with that, one hair regrowth shampoo also will be giving you. So these are the medications which we use for the hair loss. It depends on what is the expectation of the patient, if they just want to retain the existing hair or they want to regrow the lost hair. So let us discuss more in detail about the first option, which is to retain the existing hair. So what we have to do is we have to mainly start with the medications. Along with that, we can consider for PRP, that is platelet rich plasma, or the growth factor concentrate, or the peptides we can give. Coming to the second aspect, which is to regrow the lost hair, it is mainly the hair transplantation, where we take the follicles from behind. So coming to the last option, which is the hair transplantation, this is for the patients who have more expectations, or where they want to regrow the lost hair, mainly in the bald spots and all. So in this, what we do is we take the follicles from behind and plant it in the front. So however it grows in the behind region for lifetime also, similarly when we do the transplantation, the regrowth will be as similar to the back hairs what we see. So this is again divided into two procedures. One is called as FUT, where follicular transplantation we call it as, where we take a patch from the donor area, we dissect it and we place in the frontal aspect. The second option, which is very common these days, or which is more popular, is called as FUE, which is follicular unit extraction, where we extract the individual follicles and create the slits mainly in the recipient area, and we place the extracted follicles. So what you can expect post transplantation is, within 1 month, whatever the grown follicles are there, that will fall down, and within 2 to 3 months you can see the regrowth of the baby hairs, and 6 to 8 months you can see the optimum results is PRP or GFC, what we call it as. PRP is nothing but platelet rich plasma. GFC stands for growth factor concentrate. The procedure what we have to prepare is almost same for PRP and GFC, but in GFC we'll have more growth factors, so that is considered as superior to platelet rich plasma. So what we do is we take around 8.5 ml of blood from the body and 16 ml in case of GFC, and there's something called a centrifuge machine which rotates at high speed. Because of the rotational force, the blood gets separated into different components. The topmost part what we get is called as platelet rich plasma. So that we load into the insulin syringe. A small needle syringe will be there. So that we load into that syringe, and mainly in the frontal aspect, that is where we expect the androgenetic alopecia to happen. We inject that. So usually it is divided into two stages: the induction phase and the maintenance phase. In the induction phase, monthly once for around 6 to 8 setting it has to be done. Coming to the maintenance phase, once in 6 to 8 months if we do it, that acts like a maintenance. And few certain blood tests also, if we get it done, it is better. Mainly the vitamin D, vitamin B12, the thyroid profile, the ferritin levels. So these also has to be evaluated, and if there is any deficiency, we have to start on the supplements. So do consult a qualified dermatologist to get it treated. Thank you.